I think some person was trying to get
कौन?
security or something.
किसके लिए? किसके लिए? नहीं है ना, वो टेबल हटाने। हाँ वो था ना, वो जो अपने पर यूज़ कर रहा था अभी।
Hello.
What is the plan? At what time you will be taking this chair?
That is वो 3 लोग
Hello.
इसके बाद नहीं 3 लोग बैठेंगे पूरा नहीं पता योनाथ मैं और पीएस चौहान से उसके बाद 3 और अपने सोचे उसके बाद टीपी सिंह सर को पहले
So when we want to take the chair?
टीपी सिंह सर वो देखो ना उसमें वो इतना
We want to replace it or we want to take it out?
Take it out and why we both holding on
Chair.
and all.
फिर माइक्रोफोन
ठीक है, 1 मिनट हो गया ना काम।
ये कहाँ से लेगा?
ये हो गया ये और अभी मैं कर दूँगा।
अरे रुक जा, क्या कर रहे इसको कहाँ से लेगा?
अब ये जा रहा है ना ये
कहाँ जा रहा है? ये तो
इसमें से
वीडियो का है।
हाँ ये जाएगा, ऑडियो भी जाएगा।
हेलो,
इसी तो लगाओ ये।
नहीं सर, माइक्रोफोन मेरा ले रहा है, आवाज मेरी ले रहा है। ये देख,
तो यहाँ से बंद नहीं होगा इसका माइक्रोफोन, ये बाहर से जो है जा रहा है।
टाइम थोड़ा पहले निकलोगे ना।
नहीं बाहर से कैसे बंद करेगा? इसका चल रहा है अभी माइक।
9:40
ये क्या चीज़ का है?
माइक
मैंने ये क्या है?
ये तो वीडियो
मैं ये मैंने लगाया है, ये देखो, इधर देखो ना आप, ये मैंने लगाया है, इससे आउट इसमें जा रही है, ऑक्स वाली, ठीक है। अब ये दे दिया हमने यहाँ से इसको, अब इसमें कैसे जा रही है क्योंकि ये कनेक्ट है इसलिए बोल रहा हूँ मैं इससे।
ये इसमें चला गया, ये कहाँ जा रहा है? यूएसबी से इससे इसका क्या फायदा? ये तो सिर्फ लाइट के लिए है।
कौन सा है सर? ये हमारा ऑडियो डोंगल है, ये लाइव स्ट्रीम करता है हमारे यहाँ से।
इसमें
हाँ
ऑडियो कैप्चर में चेक कर, इसको डिटेक्ट किया।
हाँ इसको करो ना, इसको करो ना, यूएसबी करो ना, इसको यूएसबी पे आएगा वहाँ, इसको यूएसबी
ऐड करना।
हाँ
इसका माइक ऑफ कैसे कर सकते हैं?
हाँ ये है ना यूएसबी, ये अभी रहेगा ना। हाँ ये करो।
Very good morning, sir. Is it audible? Continue. Testing 1 2 3.
हेलो ठीक है सर.
Yeah, I just want to give her a bag, okay? Thank you.
I request all the audiences to please keep your phone on silent mode. Good morning, one and all. In the unique session of Thought Leadership Forum on Antimicrobial Resistance, it's indeed an honor to honor the eminent guests, professors, students, media person, and other audiences present over here. I, Dr. Arpana Vibhuti, Head Biomedical Engineering and Biotechnology Department, welcome you all on behalf of SRM University, Delhi NCR Sonepat. Before chemistry in 2019, Padam Bhushan Professor G.P. Talwar and Padam Shri Professor V.S. Chauhan ji. It's a great privilege for all of us to listen our distinguished guest, Nobel Laureate Professor Ada Yonath, Padam Bhushan Professor G.P. Talwar and Padam Shri Professor V.S. Chauhan ji. Thank you, professors, for sparing your valuable time and be here with us. May I request our Honorable Vice Chancellor, Professor Jaswal, to convey the presidential address, please. Respected Professor Paramjit Singh Jaswal is former Vice Chancellor of Rajiv Gandhi National University of Law in Patiala, Punjab, and former Chairperson of Department of Law, Punjab University, Chandigarh. He has a remarkable 40 years of experience in the teaching field. Professor Jaswal is the recipient of a prestigious Fulbright Scholar. He has been conferred many honorary awards throughout his prosperous career. He has written a book on the environmental law, which the Supreme Court has made references on 3 separate occasions. Sir, please.
A very good morning to all of you. It's indeed a great pleasure and honor for me to welcome the honorable dignitaries on the dais, faculty members and their students. We have today with us Nobel Laureate, Professor Yonath, Professor Talwar, Padma Bhushan Awardee, and Professor Chauhan, Padma Shri Awardee, flagged by our own Registrar cum Dean Academic Affairs of SRM University. A hearty welcome to all of you, sir and madam. I'm a student of law, and hence I start with the law. It was in 1885 when Dicey came out with the concept, Dicey, who was basically a historian in England, but he came out with the concept of the rule of law to have two things in mind: peace and justice in the society. The underlying meaning of his thesis was that each one in the society wants peace, and for ensuring peace, justice must be given to all, and all are equal in the society irrespective of their age, status, or geographical location. He criticized at that time the development of the administrative tribunals in French system because he was looking through the foggy weather of England to that new development which had taken place in France. But his new thesis was criticized, rather it became a fashion to criticize the Dicey, and Jennings did it the most. If we consider his thesis today, the rule of law is a universal concept, and it is applicable to all people irrespective of their nationality. Coming to the topic of the day, with having Nobel Laureate with us, it has become a fashion to use antibiotics. Human mind is very fertile. Various scientists from time to time developed various medicines, including antibiotics, to keep human being healthy. But the use of antibiotics became a fashion in most of the countries, including India. And we are the victim of the same. If I may say, in India, it is very easy to buy any antibiotic across the table in the chemist shop without even doctor's prescription. But it is difficult to buy a gun. The contrary is true in United States of America. You can buy a gun across the table in any shop, but you can't have an antibiotic without the proper prescription. And this misuse or overuse of antibiotics, they are the main drivers of antimicrobial resistance, what we popularly call AMR. And WHO has declared AMR as a global health emergency. Now, what happens for a layman that when we keep on taking the antibiotic or overdose or when it is not required, then the pathogens, the bacteria, they develop within the body resistance to that antibiotic, and they that antibiotic which is very effective otherwise becomes ineffective. Today, it has become a fashion. If I come out of the home and I say I'm having a cough, my driver will also advise me, have azithromycin. If I share the same thing that I'm feeling a little feverish, my colleague, my friends, my family member will say, have amoxicillin or doxycycline, whichever suits me. And we start taking the medicines directly without proper prescription or recommendation from the doctor. Therefore, it is very important to analyze and have new kind of antibiotic which are resistant to the AMR. We have a famous Sanskrit shloka, Vasudeva Kutumbakam, meaning thereby the world is one family. If we treat the world as a one family, then we should also have the one norm to treat ourselves or to live healthy. We have one earth, we are one family, and we are one future. And the General Assembly of the United Nations, keeping in view the future demands, came out with the 17 Sustainable Development Goals. In 2015, they were adopted by the General Assembly, became effective from 1st of January 2016, and the benchmark is that all the 17 Sustainable Development Goals are required to be achieved by 2030. If we focus on particularly Sustainable Development Goal number 3, which talks about good health and well-being, and when we take this Sustainable Development Goal into consideration, then the role of new antibiotic or the need to develop a new antibiotic, that becomes all the more important. Because we need to develop a new kind of antibiotic which changes the behavior of the inside bacteria or pathogen so that the AMR consequences are reduced to the minimum. The 5 pillars of the Sustainable Development Goals are people, the human beings. We all want prosperity. There are 5 P's. First is people. Second is prosperity. If people have the prosperity, then we have the whole planet as one family. So third P is the planet. And if in the planet we have peace and the property, the prosperity, then we have the peace, and ultimately this all needs a partnership. Now, 4 C's which are required to achieve these Sustainable Development Goals are collaboration, because when we treat the world as a one family, research is being done in one part of the country that has to be implemented in totality into the other part of the country. If we make the laws in one part of the nation, we have to implement in that part of the nation. I'm reminded of Thomas Friedman, who in one of the books he wrote, the future is, the world is flat because the world has shrunken into a small village. So we need to have collaboration, we need to have control, we need to have communication, and we need to have commitment to achieve the target by the given date. The 4 pillars of sustainability, which is very, very essential and centric to the Sustainable Development Goals. They are human sustainability, social sustainability, economic sustainability, and finally the environmental sustainability. The goal number 17, Sustainable Development Goal, talks about partnership to achieve these goals. because the moment we consider the entire world as one family, then we need to have the partnership among all the countries, all the nations, and then only we can achieve the target of the Sustainable Development Goals. Today, I am indeed honored to welcome Professor Yonath, who is the winner of Nobel Prize in Chemistry in 2009 for her studies on the structure and the function of ribosomes. She is the first woman from Israel to get the Nobel Prize. She is the first woman to win the Nobel Prize in Middle East and first woman in 45 years to get a Nobel Prize in chemistry. She has a very important message to tell us today. She will be interacting with us on her next generation of antibiotics which can be used to AMR. On behalf of SRM University, Madam Professor Yonath, I extend a very warm welcome to you. We have with us Padma Bhushan awardee Professor G.P. Talwar, who is an internationally renowned scientist for his contribution in the field of vaccines. He has also been honored with the French Order of Merit, the highest award of the country. He is in fact known as the father of Indian immunology. He is here with us to guide on how vaccines can help in tackling antimicrobial resistance and how to reduce the use of antibiotics or how to prevent the misuse or overuse of the antibiotics. Sir, we extend a very warm welcome to you as well. We have with us Padma Shri awardee Professor V.S. Chauhan, who is an internationally renowned scientist for his contribution in the field of malaria. He is also recipient of various other national and international awards in addition to his Padma Shri given by the Government of India for his research. I have had the opportunity to work with Professor Chauhan in a number of committees, and I have found him as an institution in himself, who is very straightforward, talks less, works more, to the point, like an scientist. His presence is motivating us, and his support will guide us. The research and development of biotechnology and microbiology and biochemical engineering at SRM UH. In addition to this, we also have Professor Samuel, who is the Dean Academic Affairs as well as the Registrar of SRM University, and he is also looking after the C4D, a Center of Drug Design Discovery of Drug that we have at SRM University. Under the leadership of eminent scientists, including Professor Chauhan, Professor Ganguly, and Tom Blender from UK, we have at SRM established Thought Leadership Forum, which is very intensively working to find out an alternative to AMR. Professor Chauhanji, we extend a very warm welcome to you for giving your full cooperation and support in collaborative research at SRM University, and we look forward to your visit to the university in the near future as well. With these words, once again, I extend a very warm welcome to all the dignitaries on the days and off the days. and we look forward to listen to all the national and international awardees who are sitting on the dais. Thank you so much.
Thank you, sir, for the inspirational introduction and letting us know about the importance of the P's and C's. I would like to request our Honorable Vice Chancellor, Professor Paramjit Singh Jaswal, to felicitate our eminent guest, Professor Ada Yonath, please. So requesting again Professor Paramjit Singh Jaswal sir to felicitate Padam Bhushan Professor G.P. Talwar sir. Requesting VC sir to felicitate Padam Shri Professor V.S. Chauhan sir. Thank you, sir. Now may I request our Dean Academics, Professor V. Samuel Raj, to felicitate our Honorable Vice Chancellor, Professor Paramjit Singh Jaswal, please. Thank you, sir. Now I would like to invite Professor Virendra Singh Chauhan, sir, for a special address, please. Professor V.S. Chauhan is the present Chancellor of Gandhi Institute of Technology and Management. He is
We really have squeezed a little bit for time. I'm going to share just 3 thoughts. AMR is something that I'm a chemist by training. I'm an organic chemist by training. We are used to synthesize molecule. I spend a lot of time making peptides, studying their structures, conformation. Useful small things. You can have a lot of fun making them and using them. So at the end of this very brief talk, I'll tell you something, how we got interested in AMR. But I read a book about 20 years back. It's called Microbe Hunters. And I very strongly recommend any one of the students who have any behind discovering them. The AMR has been thrown out, in fact, before COVID came and much before, the important issues in India health-wise, there were the tuberculosis, how to handle tuberculosis in the country. 27% of all TB load is in India, has remained in India, and the AMR. Those of us my age would remember they would have lost at least one or two members of our family, older people, because of the antimicrobial resistance. It's really something which we sleep with, we live with, is there. Paramjit mentioned about UN goals. Paramjit, another day when I come to university, we can have discussion about every single goal. What you said, it becomes so provocative, and how I can one by one tell you none of these goals will be achieved. But I'll leave that for another time, not for today. We'll go one by one of them, including stoppage of wars and so on, but I'll leave that for another time. Coming to AMR, before Boris Johnson, before Theresa May, when David Cameron was the Prime Minister of UK, that was the meeting held just before what you mentioned, and there was a science editorial in which David Cameron himself wrote, and the problem that Paramji shared with us was highlighted. And if you don't, you can go back and read that in 2015, and it's very categorically mentioned that if the West or Western country or developed countries discover, there's no incentive to discover antibiotics, and I'm sure Professor Yonath will talk about it. As a pharma company, there's very little interest, just as there was hardly any interest in making malaria vaccines. And there are reasons for that. I leave that for another time. So that editorial said that if and when new antibiotics are discovered, we would not let them go to the developing countries. And India stood out in that. So this problem is known to all of us. So when I go to meeting about AMR, I recently went to a meeting called One Nation, One Health. And AMR figured very, both in poultry and humans, figured very prominently. But I don't think there's anything that we don't know about AMR. We can lay down the whole problem in front. I've been hearing this for 25 years, that I think scientists do not know this. We're all aware of it. But if it was a solvable problem, we could have set it up in no time. There's another thing, I don't want to waste any more time on this, but if to say that this is a low-hanging fruit, why don't we stop selling antibiotics across the table? That hasn't happened in 30 years. And not going to happen so easily in the next 10 years, where the West shares antimicrobial resistance is very well known. In fact, I was quite stuck. I was in Goa, chairman of the India Peptide Society. How many young people who've come back from US, Germany, or Israel, very well trained. Because there is a huge amount of research and money in AMR, many of them have been trained in them. And let me bring the second point I want to share with you. In 2008, we got interested because we were looking at structured peptides. We knew body, all living system, frogs or snakes or us, as a natural defense. In fact, bacteria defend themselves against viruses by CRISPR. We defend ourselves again much before penicillin was discovered by Fleming or developed by Florey in Oxford, much before that. So it's been used. The body makes its own large number of peptides. Miganin, whole lot of them, defensins. In those peptides, there are reviews after reviews you can read. There are certain peptides which are negatively charged and they're structured. They assume helical structure. Those of you not familiar with biophysics, just imagine this, that these peptides you can make and their body makes them and fights bacterial infection as much as they can. Bacteria are simply stronger. So we started doing this in somewhere 2008. And here is a message. We were decently funded for this. I had several PhD students who did amazingly good work, and much to our surprise, we could construct small molecules, molecular weight less than 1500. These are peptides, designed peptides, AB initio designed peptides. Very strong antimicrobial activity, but very high hemolysis. So they were of no value. I mean, you can publish a paper, but they were of no value. But we played around with structure activity and found, as I speak with you, 2 excellent candidates. And we presented this to a funding agency. The funding agency liked it very much, and they funded us, and we have a startup company in India, both Nitin is sitting here, to just push this further. When the push is coming to shove that we have the peptides, we can make them, but this is the message which I want to give. Those of you who will enter science, we can enter like this, head down, and might see many walls. Some walls you can break, some you can't. But let me give you this in the next 2 minutes perspective. So we're funded, we have all this, but lo and behold, none of the pharma company where you have to produce the molecule for preclinical development, like for malaria vaccine work that we were doing, is prepared to make them. Now, if no one is prepared to make them, what you come out with, look, academia has produced this, you have produced that, but no company wants to. But this is absolutely true. I have a lot of friends in pharma industry now. I'm old, so I know a lot of people. And they said, no, sir, there's zero interest in developing antibiotics for many reasons. Of the top of the shelf of that reason would be that by the time you introduce, you take it down to phase 1, phase 2, phase 3 trial, approvals and so on, and bring it in a couple of years, you're going to get resistance anyway, because that's the way you could use. And that's the story you'll hear. So whatever research you do, you must, and if you want to, what today in Indian government or funding agency will tell you, you must upfront think what is translation research, how to, it'll be very good at it, look at where should you pitch. Coming back to antimicrobial resistance per se, if I'm running ICMR, Indian Council of Medical Research, or Government of India Health Ministry, what do I do? So we had this meeting about a week back. So we should do surveillance. But nobody can argue that we should not do surveillance, whether it is viruses, whether it's COVID, or it is AMR. But we know there is a huge amount of resistance. It has been mapped for years. How do we take the next step? Well, I wish any one of us knew how do you take the next step. So one thing is relentless. You'll hear Professor Yonath saying there might be another way of dealing with microbes, especially antibiotic resistance. She knows this. In India, multi-drug resistant tuberculosis is the reality of life. Even if we ignored it, extremely resistant tuberculosis is a reality of life. If normal TB takes 6 months to treat, the protocol for multi-drug resistant TB runs into 2 years. Compliance becomes very important. So what am I saying? Am I saying that these are unsolvable problems, therefore just leave it and don't worry? Certainly not. That's why it's very important for me to give you this message. This is going to be a tough fight, a different fight, but this is a fight which is worth taking up. So expand yourself when you enter an area like that. Look at all complications. You don't have to solve the last complication first. You have to take small steps. And those of us, Professor Talwar finally did produce a vaccine which went into trial. We did produce a molecule which went to phase 1 trial. So this is doable. But sometimes, and my last comment is this. We learned this from COVID. Artificial intelligence, we can do this, we can do that. One tiny virus with 30,000 nucleotides brought everyone on its knees. And it also exposed what Paramjeet said, that the UN charters, it showed very quickly that the rich will behave as rich and poor will behave as poor. There are no laws of the land. When it came to vaccines, some countries had vaccines 10 times the amount they needed. Some countries have not received vaccine of COVID even today. So UN charter business, you and I have to have a discussion in your universities at a roundtable discussion. So COVID taught us, have we learned things from COVID? We would think yes. But my own understanding of humans is that we really don't learn lessons. If we did, we wouldn't be fighting in half of the world. We don't learn lessons. So going back to AMR, it's not an easy problem to solve. It's a great scientific challenge. Many of you should get into this, but don't get fooled by this. At least I don't get fooled by this at my age. I got infected with H3N2 last 2 weeks back. It knocked the wind out of me completely. So the bugs will be there. So I'll finish my last comment with a Joshua Lederberg comment. Joshua got Nobel Prize very earlier on. And those of you who want to be serious and go back to Joshua Lederberg, read 2 articles, one in Science and one in Lancet, many years back. He doesn't live anymore, he died. And Joshua said, and I'm just quote, I don't have the quote, that this animal on 2 legs feels it's smart and also feels that this is the only animal who should live here. All other life should disappear or should be surveilled or otherwise subjugate to it. And he warned that this is what will be the downfall of our species, the arrogance of humans, that we can figure out everything. We can't figure out everything. Evolution will not allow us this. You can't reduce forest space, for example. You said about environment. You can't take bats' residence from bats away. And I think you should all think about this. I think going forward, the future of Earth will be in your hands.
Thank you very much, sir, for the illuminating talk and discussing the challenge to tackle with the AMR. Now I would like to invite Padam Bhushan Professor G.P. Talwar, sir, for a special address, please. Professor Talwar, being Professor and Head of Biochemistry, AIMS, Jawaharlal Nehru Fellow, Scholar in Residence, National Institute of Health, Bethesda, Founder Director and National Institute of Immunology. Welcome Professors John Hopkins, Baltimore, Professor of Eminence, International Center of Genetic Engineering and Biotechnology, Director Research, Talwar Research Foundation, 2000 onwards, and Distinguished Professor at SRM University, Delhi NCR, Sonepat. He has been conferred many awards, and he has been the President of Indian Immunological Society, Endocrine Society of India, Indian College of Allergy and Applied Immunology, Association of Clinical Biochemists of India, and Indian Academy of Vaccinology. He has elected as a President of International Society of Immunology of Reproduction and first President of Federation of Immunological Society of Asia Oceania. Professor Talwar was conferred Padam Bhushan by President of India and Officer de la Légion d'Honneur by President of France. Sir, please.
Let me first say how happy I am to be with you, and thank you very much, Vice Chancellor Ji, for again inviting me to benefit from the talk that I am looking forward from our Nobel Laureate visitor. But then they asked me also, please say something scientific also. My interest is in vaccines, as everybody knows, and I have therefore a few slides to share with you. My current interest, would you please put on the slides now? It's on. Well, as you see, according to WHO, more than 120 million couples still have an unmet need for family planning, and 45 million unintended pregnancies are terminated each year globally. So this is an issue which has bothered me, and I have tried to see whether we can do something better than what the current contraceptives offer. Next slide. We thought, why not make a vaccine for contraception? That will require only periodic intake and no day-to-day intervention as is generally required. Offers privacy of use to women in crowded households, and it will also be hopefully low cost and affordable by all. Next slide.
Slide present. This
कौन सा?
nice.
ये वाला.
Sir, वहीं से लगता है.
Sorry. ये.
एक मिनट. ओके सर.
ये करना है.
हाँ सर.
Okay. Now you know. आप ही कर दीजिएगा जी. For making a vaccine, one had to select a target. And we chose human chorionic gonadotropin as a target. Why? Because human chorionic gonadotropin, or HCG, is not made by a normal woman till she becomes pregnant. So it is not there anywhere in the body normally. And it only comes up as and when she becomes pregnant, and in fact it is the test for pregnancy detection. So we thought this would be a very safe target for a vaccine because it will not cross-react with normal human tissues and organs, and nothing in the body will be disturbed. That was the reason why we chose this as a target for making vaccine. What is HCG? It's composed of two subunits, which is all sequenced and known. Its structure, as you see from this slide, there is the alpha and beta HCG, and the two together join to make HCG. Next slide. Now, obviously, HCG per se will not be immunogenic. It has to be made immunogenic. And to do that, you have to link it to a carrier. And we used originally tetanus toxoid or diphtheria toxoid as carriers. Why? Because by that vaccine, which is composed of one part of beta subunit of HCG, and it will not only make antibodies against HCG, but it will also make antibodies against the carrier, which is tetanus or diphtheria, and therefore it will confer protection against that disease to the recipient. To see whether it is true, obviously one has to conduct actual experiment. And here is the vaccine originally made, which was the beta HCG linked to tetanus. And you see here that there are antibodies against HCG, which if you inject 5,000 IU of HCG, the antibody titers come down, so the antibodies bind with the HCG, and this in turn again the original titers are renewed, more antibodies are formed. On the other hand, nothing happens to the tetanus. Those antibodies stay, don't react with the HCG. So therefore, the concept of the vaccine was proven by such actual investigation. The next obviously is to see the safety of the vaccine so made, and this was determined not only in India but also in Finland, in Sweden, in Brazil, under the auspices of the International Committee of Contraception Research of the Population Council, New York. So these trials have been conducted everywhere, and they are all reported, and everywhere they found that the vaccine conceived is totally safe in women to take up. Then, after determining and confirming the safety of the vaccine, the next question is it effective? And to find that, one is to conduct the phase 2 trials, which are the trials to see whether a non-pregnant, sexually active young woman immunized with this vaccine remains protected from becoming pregnant. And indeed, the study, no, please don't change. I have not yet finished this slide. So we enrolled about 145 women at the All India Institute of Medical Sciences, at Safdarjung Hospital, and at Sir Gangaram Hospital, and also at the PGI Chandigarh, the PGI Medical Education Research Institute. And these trials, which are all published, it's in a PNAS proceeding, National Academy of Science, USA. They're published. And here I'm showing one slide out of that paper where representing 4 women who were immunized. Now what you see from these lines are the antibody titers which are there, and then in course of time they decline, and then you have to give booster to push them up again. So by doing all that, you can maintain these women protected for say 29 cycles or 32 cycles, or you see they are written on each one of these 4 women's report, and they are protected, they didn't become pregnant. While they were sexually active, they were all young women, healthy women, ovulatory, each one of them was ovulatory, but still the vaccine was effective in preventing them and protecting them from becoming pregnant. Next slide. So 8 women completed more than 30 cycles of being on the vaccine protected, and 9 women 24 to 9 cycles. So it was quite enough data to assure you that indeed the vaccine works. It works and it prevents pregnancy to occur in sexually active young women who are ovulating. And what is more is that by vaccination, you do not change her menstrual regularity. The past slide would show you, एक पीछे जा सकते हैं, तो एक slide पीछे कर दीजिए. You see on the top, on the top of each slide are those dots. These are the days of menstruation, and you see they remain regular. So the vaccination has not altered the regularity of menstrual cycles, and they are all ovulatory as seen by the progesterone levels and by the hormonal levels. So they are all ovulating, they are having normal cycles without any derangement, but till there are good antibodies above 50 nanograms per ml. Here downstairs you see the ... 50 nanograms is the threshold we've assumed that this will be the protective threshold for preventing pregnancy, and indeed this was true as determined by these trials. Next slide. So only one pregnancy took place in 1224 cycles above 50 nanograms per ml without derangement of menstrual regularity, without disruption of ovulation and hormonal profiles, which remain normal. I think this is a very unique contraceptive of its own type. Next slide. Then you see the next issue was, will they regain fertility if they want to have another child? Even this was determined in 4 women who were not given booster, and therefore their antibody titers were allowed to come down to below 50 nanograms. At that point, they conceived again, all 4 of them. So their fertility, ability to regain fertility and have more children is not altered at all by the vaccine. And what is more is that the progeny so born is totally normal. Professor Mehrbaan Singh, who was a very good pediatrician at the All India Institute of Medical Sciences, conducted an extensive study on these women conceiving again and getting a child. That child was completely normal, no bad effect of immunization on regaining fertility. Next slide. You see, all this was done by chemically purified material. Beta-HC was purified and then linked to the carrier tetanus or diphtheria toxoid. So, but you see, if you have to industrialize in today's era anything, genetic engineering is the route, because today the manufacturing by genetic engineering route is cheaper on a large scale to go to public. So we then converted this vaccine into a genetically engineered type, and here it is. This slide shows that. You see the beta-HCG linked to a carrier, which in this case is LTB. Next slide. And then you always need an adjuvant to put. And we used an adjuvant which, by the way, by itself is a vaccine I'm very proud of. This is a vaccine against leprosy. This is the only vaccine against leprosy made in the whole world. It is approved by DCGI, our own drug controller, as well as by the US FDA. So it's a very good vaccine, very effective against leprosy. And this is based on a non-pathogenic cultivable mycobacteria, whose gene sequence has been determined, and it has been named as Mycobacterium indicus prani. Pran is my first name. NII is the institute from where the trials were conducted. So this is the, sorry, this is something which by itself I am very proud of. This is an approved vaccine and is now passed on to industry to be available to public. Unfortunately, as this adjuvant is a potent invigorator of immune responses, the company to which we passed on, which is Cadila, sells it for cancers, for psoriasis and so on and so forth. It is effective in all those conditions and charges a huge price, because in our agreement we had fixed that he will not lay down high price for leprosy vaccine. But what the company does is, company has not remained very honest. It has been making money by selling it under different names for other purposes at a high price. By the way, let me also tell you that this very vaccine is very effective against tuberculosis. In category 2, difficult to treat tuberculosis, there have been trials, and adding this vaccine, the MIP, to, let's say, the usual drugs, results in better sort of clearance of tuberculosis, better treatment of tuberculosis than the drugs alone. And also the relapse rate is much lower. So it's a very useful vaccine, I would say. I'm very proud of it. Next slide. Next slide. This just to show that it indeed is a... Then another thing that we did in genetic engineering is that the genetically engineered things can be in form of DNA as well as in form of protein. So we saw that if you first prime with the DNA and then give protein, the response is better. So our so-called genetically engineered vaccine consists of primary injection with the DNA form of the vaccine followed by the protein form. Next slide. Next slide, please. The current status of this vaccine is that RCGM is the recombinant products authority. It has already approved the recombinant vaccine after extensive toxicology. 5 years those toxicology studies were done nationally and internationally by various companies, after which they approved it. So it has got the approval of RCGM, and it is now under the aegis of the Indian Council of Medical Research. And the vaccine has been passed on to Bharat Biotech because obviously, the whole idea is that it should be made under GMP conditions at a facility which has all the all the setup for such work. Next slide. Now you see another very interesting property has come up, which we did not expect originally, and that is that there are a whole lot of cancers which ectopically make HCG at a time when they are at a very advanced stage and become refractory, leading almost to the death of the person. At that stage, you see them expressing HCG ectopically. So you see, this is another facet that we are currently busy with, the immunotherapy of such cancers. Next slide. Also, it is good for obesity too. Next slide. Cancer is now the focus of our study, and we are trying to see whether we can do something to those cancers which are now, which give the signature that the guy is going to die. And to save him, we are trying to see whether we can, as they express ectopically HCG, whether we can treat them by vaccines, by a monoclonal antibody which we also had made many years back, etc., and by a immunotoxin which we have made, again genetically, linking the humanized FAB with the toxin sarcine. Next slide. Ectopic synthesis of HCG by tumor cells, you see so many references. Can you imagine that in addition to pregnancy, HCG appearing in such cancers? Next slide. All over the world, there are reports of such cancers. Next slide. So, also we have as I told you, a monoclonal antibody. By the way, it is this monoclonal antibody which we licensed to an American company that I got $750,000, which has made the institute in which I continue, the Talwar Research Foundation. See, all these HCG expressing MOLT4, U937, Colo 205, colon cancer, hepatocarcinoma, and then pancreatic cancers, bladder cancer, lung cancer, all these are the ones which express ectopically HCG and where we can intervene with our setup. Next slide. Here is it. The binding by flow cytometry, you can see 95 to 96% of cells are expressing HCG. Next slide. Next slide, please. And you see with the monoclonal antibody, you can kill up to 96% of these cancer cells. So here is another unforeseen application of targeting HCG. This will also be useful not only for control of fertility, the death of the individual. Next slide. Next slide, please. Oh, okay, go ahead. Next slide. This is the immunotoxin which we have made. Next slide. Next slide. This is the immunotoxin purified. Next slide. So immunotoxin has been tested. Next slide. And you see that even in nude mouse, you can reduce the size of the tumor substantially. To sum up then, what I've shared with you is a vaccine developed against HCG, killing HCG, bringing HCG to a carrier, and it generates neutralizing antibodies against not only HCG but also the carrier, tetanus, diphtheria, or whatever it is. Then the phase trials showed safety in women. Phase 2 trials in 148 sexually active women prevented pregnancy without derangement of ovulation and menstrual regularity. Next slide. And return of normal fertility in the absence of the booster dose. Progeny born to such women fully normal, that has also been tested. And then a recombinant vaccine version of the vaccine has been made, which has received the approval from DCGI for clinical trials, and additional utility of the vaccine will be in advanced stage drugs refractory terminal cancers expressing HCG ectopically. So also there is a potential for curing obesity. Thank you very much. Next slide, last slide. I must give the credit to those who have worked. You know, these are all my students and co-workers. They have done the work, so they deserve the credit. Thank you very much. I am ready to answer any question that anybody has. Push Lundi? Anybody wanting to ask any question is welcome to do so. And thank you very much. Sonepat is now my part of my life.
Thank you very much, sir, for the inspiring talk. It's indeed very interesting to know about the importance of vaccines for the pregnancy and cancer event. Now I would like to request our Dean Academics, Professor V. Samuel Rush, to address Thought Leadership Forum on Antimicrobial Resistance.
Thank you very much. It's my privilege to be here in front of you all, and especially my very special thanks to Professor Yonath for taking the pain to come from all the way from Weizmann Institute of Science. When I met her day before yesterday in the airport, she was looking very tired, and I felt very bad. And then I asked her, "You feel very tired?" And then she said that, "You too." And she gave a very big smile. Then I was so comforted with that smile. So we can see that all the good smile that which comes from Professor Yonath all the time. And that much she has a love for the science. She always talks about any field you take it, and you should have curiosity. That curiosity drives you. And that's the reason that out of curiosity, she did a lot of work in ribosomes, a very big structure, many proteins, and she has crystallized, and she got the Nobel Prize for that. Everything started with a curiosity. That's a lesson that we are getting today. And also we have the tallest people in the field of science with us, Professor G.P. Talwar and Professor V.S. Chauhan. The Padma Bhushan Awardee Professor Talwar and Padma Shri Awardee Professor V.S. Chauhan. They are expert in that particular field. And especially Professor Chauhan is working on the field of malaria and antimicrobial resistance for a very long time. I always look at him and wonder that one side the administration, the other side the science, how he is managing both. And he is an example in front of us. And my very special thanks to Professor T.P. Singh, who is the instrument for getting this INSA Auditorium, and he is with us, and he will be chairing the session of the keynote address by Professor Yonath. And also I would like to acknowledge the presence of Dr. Pranav Sharma, the Policy Secretary of Science 20, S20. He is here with us, and I would request him to take few minutes after me to say about S20. In fact, as you see the logo here, S20 is part of our conference, our meeting, our event. And this is the event by the Thought Leaders Forum. That's what I would like to take very few minutes. Considering the time, I will make it very short. As part of this event, INSA is also the partner, and iRise, inspiring India in research, innovation, and STEM education. STEM stands for Science, Technology, Engineering, and Mathematics. iRise, and also this is the initiative of British Council, Department of Science and Technology, ISER Pune, Royal Society of Chemistry, and Tata Technologies. Along with them, now SRM is also a partner in Thought Leadership Forum on Antimicrobial Resistance. As Professor V.S. Chauhan said that everybody is aware of antimicrobial resistance. We are talking more and more about the past 20 years. The government knows, the scientists know, the doctors know, including the patients also know that, but still we are doing the same thing. Nobody has stopped. There is a misuse or overuse of antibiotics. Many people, they take the medicines with their previous prescription. Getting the antibiotics, as our Vice Chancellor said, it may be difficult to get the gun, but it's very easy to get the antibiotics in our country. But in other way, it's vice versa. In a countries like USA, it's easy to get the gun, but it's very difficult to get the antibiotics. The study says that in 2050, more than 10 million deaths will be due to this antimicrobial resistance. And this is not the future that we are predicting, but it's the present that we are facing. With COVID-19, the antimicrobial resistance has increased because of many antibiotics were indiscriminately it was taken. Overuse of antibiotics also. So antibiotics, it's happening in 2021, along with Professor N.K. Ganguly, that we have written a white paper. And also it was published in more than 20 leading newspapers in India. And one of the suggestions, I don't want to talk too much about that. One of the suggestions that what we were giving is that one, definitely we need a multi-sectorial approach. We cannot, only the doctors cannot solve the issue. The scientists cannot solve the issue. And this is the time that we need to join together with everybody. That's the reason that we have started a forum, Thought Leaders Forum. And SRM University's website that you can see that one. Please go through the website. In the first page only that you will be seeing that one. Along with Professor Tom Blundell, Professor N.K. Ganguly, and our Professor Paramjit Jaswal is also there in the advisory board. And we have so many people, not from the doctors or the scientists, and also people from the legal side, people from the management side, commerce side, market research. Everybody is there working as a team. And this is the time that we should unite together and we need to work. And very little I would like to highlight what we are doing at SRM. In 2005, when there was a sudden outbreak of meningitis, our team, I was working at Ranbaxy at that time. My team has started a research and collected the Neisseria meningitidis. Until now, we have it in our -80. Nowhere in India that outbreak strains are available. We have it, I can say that in the whole world. And in addition to that, we are maintaining about 5,000 clinical isolates, which are multi-drug resistant pathogens, very carefully that we are maintaining it. Only I know the list where it is kept and how it is protected. But for research purpose, it is available. What we have done, or what we are doing is that one, and one of the research is the indolamide, a small molecule, which is in collaboration with Johns Hopkins University, which is in the preclinical trial right now, and which is targeting this mycobacterial membrane protein large 3, MMPL3, which is in the preclinical stage. And our team is working on the neonatal sepsis. I'm glad to inform that my PhD scholar Kusum, who has completed the PhD on this particular topic, is also here with us. What she has done is that such a multi-drug resistant strain that she has used 2-dimensional of drugs as well as the 3-dimensional of the drug, 3D, 2D, and everything she has done. And she has come up with a beautiful combination of drugs against this one. And in future, if there is any neonatal sepsis, we are confident that we will be able to take care of it. And our lab, especially the Center of Drug Design, Discovery and Development, one of the major area what we are focusing is that repurposing of the drugs. Now, we are going to enter into the new era of collaborating with Dr. Reddy's lab. For that purpose, we are going there tomorrow along with Professor Yonath. And I'm glad to see that one she is also interested to have that collaboration on the particular aspect against multi-drug resistant pathogen targeting the ribosomes. For this very special reason, we could join collaboration with DST, ISER Pune, Royal Society of Chemistry, British Council, and the Tata Consultancies. For that reason, we had a meeting on 14th and 15th November at India Habitat Center. As Professor Chauhan says that we cannot resolve this issue of antimicrobial resistance by talking or just by having the meetings, but we need to join hands together to come up with a solutions. In that connection, I'm so glad to see that Professor Yonath is here to give that in drug discovery which area that we can focus. Can we target the ribosomes? Can we come up with this RNA therapeutics? And that's what we are going to listen today. So without taking so much time, and we are here, we will work together. will join hands with each other. Multi-sectorial approach will be the right solution for the future. And I would request Dr. Pranav Sharma to say a few words about the S20. As I said, that I'm glad to see that S20, G20 is here with us. So we will be part of this S20 and G20, and we'll be taking this main issue of antimicrobial resistance. But we need to come up with a solution how we are going to mitigate the AMR. We cannot eradicate AMR. It will be there. As long as we are having medicines, definitely there will be AMR. The bacteria will find out its own way to overcome that one. But we need to be one step ahead and mitigate as well as slow down this spread of AMR. Thank you so much, and please listen to the talk after Pranav Sharma talks about this S20. Thank you so much.
Hi guys, good morning. Very good. Nice spirits. Ladies and gentlemen, my name is Pranav. I'm not a doctor, unfortunately, but fortunately also. I'm Policy Secretary for Science 20. We are doing some interesting work representing the science of India, taking the global south along with us, but also doing a global discourse that leads to the better of science in the next 20-25 years, which our Honorable Prime Minister is calling the Amrit Kaal. So I'm going to apprise you of what activities of Science 20 we are doing, the kind of policy work that we intend to do, and also about the kind of work that needs to happen and where are the bridges. And for those people who are seeing reels, please do record this. I'm also, I would like to thank everybody on behalf of Dr. N.K. Mehra, who couldn't be here, who was supposed to do this presentation. In spite of me, he is our Vice President International, and he sends his very best regards to all of you and everyone who's present here. All right, how do we do this? Okay, so first things first, we are looking at the G20 this year with the theme One Earth, One Family and One Future, which has been the inherent value system of our society and civilization in the East. And thanks to the Honorable Prime Minister, it became the theme for the G20. We're bringing everybody along. We are doing good things, but doing it together. For this year's Science 20, we came up with something which is not only relevant but time sensitive, which is we need to utilize disruptive science for sustainable development. This year at the UNGA, we are taking account of what happened to the SDGs. It's halfway realization of the SDGs, and this is about time that we utilize the finest, the forefront of disruptive science to actually achieve some of these sustainable development goals. Well, I think most of these things are said well then understood, but I think there's some deep thought that goes into the fact that the future of our civilization, like future of all civilizations, and I think all of us would agree, and if you don't agree, then we would need to have a better debate than this, depends on scientific and technological advancement. There's no way around it. It has become not only incumbent on scientists to take the onus of the civilizational cradle, but also for scientists to understand that they need to take everybody along. And that is why Vasudhaiv Kutumbakam. So this year, what we are trying to do is trying to create an effective dialogue on science and policy and diplomacy, not only to do mega science, as they say. No, that is not the only goal, but also how we bring something like clean energy to an equitable and just world, where energy equity, where energy distribution is equally among its partners, where health is not only achieved by the virtue of hospitalization and other kinds of medicine, but also through traditional practices, through practices that have been there, through better nutrition, through better food and farming practices. And the most important thing that we are doing in Science 20 this year is how science can connect and intermingle with our social hegemonies, but also part of culture. And that is a global project, ladies and gentlemen. There are different working groups in Presidents of India. You can find all of this on the website. I just used it as the placeholder. It started in Germany, the Science 20, and that's been going on for a very long time now. It's the 7th time we're doing. So Germany was followed by Argentina, was followed by Japan. Then there was Saudi Arabia, Italy, Indonesia, and then it's us. And for past 3 years, we've been continuously looking at emerging from pandemic. And this year we said that we are going to utilize, we are going to look ahead right in the eyes of the future, not meddle with the past. Yes, it is extremely important, and it is important to have the remembrance of what has happened. We need to account for it, but now is the time that we take the cradle, we walk right into the future, and that is why, ladies and gentlemen, disruptive science. So the 3 themes, as I said, are clean energy for greener future. We are going to change that. It is going to become just future, which means we are going to utilize equity distribution, which my lawyer friends here would understand more, to ensure that energy, not only clean, but green, is equally and equitably divided amongst the partners. And then we look at how universal holistic health is achieved. It is important to have medicinal research, but it is also important that we understand what happens in the mind. There's a global project that we are pushing forward for the mental health issues. There's a global project that we are pushing for better nutrition security, which comes up with, if you have more nutrition, if you have better, food practices, a holistic health can be achieved through that. And then we have connecting science to society, and I'm extremely honored that we have Professor Chauhan, Professor Talwar, and Professor Yonath here who've created history, and we are witnessing them. It is a great pleasure. And these are the inception meeting has already happened in Pondicherry. We are going for the clean energy meeting in Agartala in 2 weeks' time now, followed by the health meeting in Lakshadweep in May. Then we have June meeting on Science for Society and Culture in Bhopal, and the summit where we talk about policy recommendations, we talk about the synthesis of policy, we talk about how these global projects, the G20 projects, are going to go along together. And not only we are doing it for the Science 20, the G7 nations, the science academies of the G7 nations have joined hand together. And we are really working hard on getting some decent policy recommendations worked out, which have tangible and measurable outcomes. Our Vice President International, Professor Narendra Mehra, was just in Tokyo for the G7 science meeting, and we've committed that India, by leading Science 20 this year, will come up with effective, tangible, measurable action points in science. But in the last thing that what I want to say in this slide are, we'll come back to this, is that how many of you are lawyers? Good. Your Vice Chancellor is a lawyer. How many of you understand that law is extremely important for administration? All of you understand that law is extremely important for administration. And do you also understand why administration is important, right? To run the society in a certain direction. So this year, we are also dedicated on creating effective measures and bridges between science and governance, between science and law, between science and politics, to ensure there's an effective dialogue. As I speak right now, the Interparliamentary Union is meeting in Bahrain to discuss on how scientists and parliamentarians can work together. And that is one of the effective points that we worked out between ourselves and the chair of science for IPU, Dennis Norton. The other thing that is extremely important is that not only politics needs to be engaged with science, but science needs to be engaged with politics. These are the guys who are going to write down our budgets, and we are going to solve the problems for the world. In the end, what I want to say is what the Prime Minister has effectively said, that science must meet people. Science must be for people. We need translatable science, as Dr. Chauhan has said. We need science to work together with civilizational objectives, and that is why this Science 20 is going to be a change-worthy Science 20. We are bringing artificial intelligence, machine learning, frontier technologies to work together for sustainable development. Thank you, ladies and gentlemen, for giving me the time and opportunity to do this.
So thank you, Professor Samuel, for the informative talk about AMR, and thanks to Mr. Pranav for introduction Science 20 for the society benefits. Now it's time for the keynote session of today's forum. I would like to request Professor T.P. Singh to come upon the dais to chair the session, please. Professor Tejpal Singh is an Indian biophysicist known for his work. Yes, he is well known.
Good to see you. So I have to go there or here?
No, you have to chair the session. So
I have to say a few words about
you can
her.
speak from here.
No, I have to say a few words about her.
So you can take the...
You come there? No, I have to say a few words. I will just tell you that I am an outsider to this gathering, and I am here because Yonath is my friend, and I greatly value my friendship with her. I think all of you have come to listen to her, and the purpose of her being here to inspire. You want to come here or you want to sit there? I will have to say a few things about her. I think there is no need to make a formal introduction about her. Everybody knows about her, and since Google is there, there's much more than one can talk about her. But she and I have met 45 years before, and we have been since then interacting all the time. So you will be hugely inspired by what she will talk. But before that, I want to comment on what has been talked here before and what she will talk also. You see, these bacteria and viruses are not our enemies. They are our friends. They come to stay with us. They don't come to kill us. This is fundamental. And don't worry about AMR. This is what we have to learn from this and sort out issues. There's no problem. Scientifically, these problems are very simple. So you should take antibiotics. There is no issue about this. Once we know what are the target proteins, what she will talk today, you know what binds there. So you can design your molecules optimally in a manner that there won't be resistance. There's one more thing. I think why we suffer because of these infections, because our innate immune system is very weak. It's weak because we haven't cared for this. And now we understand innate immune system and we know the ways how to make it better to protect us. So if you have pathogens entering your body, if innate immune system can protect you for a while. Such a harm, if you had good innate immune system, you wouldn't have suffered so much. And then, in the meantime, your antibodies will take over. So this thing we have to understand. So there is no, for scientific community, pathogens are very nice. I just want to tell you to feel better about them. It's only that we have to learn how to tackle them. And now we are understanding many things about them, we can solve these problems. So coming back to Professor Ada Yonath, she's a fantastically inspiring personality, as said by Samuel that she was smiling. And I really appreciate that she takes all the pain to come over here. And I should give you some instances. She worked for so many years, and the results came after many, many years later. So many, many years she worked and worked. You can imagine the frustration scientists can get when you are doing your work, you are not getting results. And most of the times in scientific research, in big scientific research, we get results very few times only. Most of the times we are working, but results are not coming that rapidly. So I have seen her struggling for many years, going through frustrations and desperation. And even other people were losing patience with her. What's going on? So Max Planck Society was losing patience. So many scientists were worried about why things are not happening. You see, she's the one who first started work on ribosomal structure. Other people came on the scene maybe 20 years later. So what matters is that who conceived this problem first. And we started working in spite of knowing fully well that at that time, solving the structure of ribosome was not possible. The first time I saw crystals in 1980 or 78, no, not 78, 82. Yeah, you had crystals in 78, 79. The crystals were so tiny and we had no methods how to determine structure of such a complicated system. But she went on. So that is the inspiring thing. I think science is not just the eventual outcome, it is the process in which you are going through. It is so exciting, you know, when you look at scientific, particularly proteins, when you look at, you find so many exciting information about them. They just don't leave you at all. The biggest entertainment for a scientist is to see the new things in the process of hard work. I think she is one also a great traveler. Once we had a chance to sort of interact. We were in the same city. I said that we should meet. She said, okay, up to 2 o'clock in the night, we can meet here. But after 2 o'clock, you have to go to the airport to meet me. So we met at 2 a.m. and we discussed things. And there was no way, there was no this Uber or Ola. We had to walk on the street. I had to walk on the street to meet her in the guest house. So I seen her through the period. We interacted so much. We all undergo so much frustration, so much difficulties in research. But today she is the speaker. But when you say no,
They will come. They will come.
she will come. To climb. Will we be there?
Yeah.
Shall I go down?
You can start it. It's going to take a little while.
No, she can start.
Hello, good day for everybody. I don't really know what to say at lunchtime. Good lunch? Good midday?
Excuse me.
Sorry. There. Perfect. Thanks.
Thank you. Thank you very much.
יופי. תודה לך.
היה קשה, אבל
הצלחת. So you got already some introduction about the problems with bacteria, with AMR, and you heard about my involvement in determining the structure of ribosomes. Why are these two subjects connected? Because ribosomes are the target for almost half of the known antibiotics, because they are so important in order to stop the life of the host, which is the dream of the bacteria. Then paralyzing the ribosome is a very clever and efficient way. And therefore, my studies on ribosomes led me into antibiotics. As you will see, it led me into some more medical problems. But in order to start, I have to tell you something about ribosomes, because I'm not sure you always studied it, and I don't want to trust your teachers. So the ribosome is actually the machine that reads the genetic code that you can see here. Can you see my... Yeah. You can see here coming in as messenger RNA, and now messenger RNA is very popular, so I don't have to explain what it is. But it's actually the copy of the DNA. And the amino acids that are building the proteins are brought into the ribosome, which is shown here, made of two subunits, small and large. The amino acids are connected to other molecules of RNA, transfer RNA, tRNA, that for each amino acid there is a specific tRNA which can read the pair of it in the messenger RNA, or actually in the DNA. So this drawing is using colors to show that this tRNA will be at the end bound here. The blue, the light blue is here, the dark blue already finished. So each tRNA brings an amino acid, like you can see here or here, and it will be connected within the ribosome to the growing protein according to the sequence of the DNA that codes for this protein. That's all what the ribosome does. Ribosome provides the correct positioning, that's all. It doesn't do anything. We didn't know it, and it was assumed that the ribosome does catalytic work. But as I will show you, it is not. It just let binding. So first, how many ribosomes are in cells? In active cells, for instance, in the liver, they may contain up to 6 million ribosomes in a normal human cell, in each cell. Even in bacteria, the number of ribosomes may reach almost 100,000 in one cell. So first thing we did, we saw how ribosomes work, and I think instead of talking a lot about how to choose and so on, I'll show you what we found. Can you see? No, you can't see. Can you make dark?
Less light.
Sorry? I think, can you darken the board? You see in the dark, you see better. So what you see here is the messenger RNA. The line is coming into the small ribosomal subunit. I told you it's made of two subunits, and binds to its position. There is a channel for it. Binds correctly to its position, and this is also navigating by factors. For instance, you can see here initiation factor 3. All what you see here is a bacterial ribosome. It's a little bit simpler than a eukaryotic ribosome, so I'm showing it this now. Also, this is the first structure that we determined. So the messenger is coming with the information, binds to its correct position, and when this happens, the first tRNA can come. Oops. So the first tRNA can come to what is called the A site. There are 3 sites, A, P, and E. So now we see the movie from the beginning. Messenger comes in, goes into its path, it sits there, and the first tRNA comes and keeps its position. It comes with initiation factor. This is blue thing. When everything is fine, the 2 factors can go. The tRNA is still bound, and the amino acid, this is the little dot here, this is the amino acid, the important piece, is now in place. So now the large subunit can come, associate with the small subunit by bridges and so on, and the ribosome is ready for work. So more and more tRNAs are coming with the amino acid. They are brought by elongation factors, and the ribosome helps in and out real quick. They come in, the message is read here, and the newly amino acid is bound to the newly bound protein there in the large subunit. I took away the large subunit so you can see how fast the sequence is being read, and meanwhile the bonds are being made here, and now you can see the whole ribosome, and the small newly born protein is coming out and folds. When there is a stop codon, instead, I'm sorry about this, instead of a new amino acid that is coming, there is a stop, and the protein can come out and fold. So let's see it real quick again. The messenger is being bound. The tRNAs are being brought in. First bind to the site P, but then to the other sites, the other 3 sites, A, P, and E. A is amino acid, P is the protein, and E is the exit. And the whole sequence of events happens. You can see that the ribosome helps in and out of the amino acid. And meanwhile, the peptide bond is being built here. And how the peptide bond is being built, I will spend a few minutes on it too, but in a minute. Here you can just see that the newly born protein goes into a tunnel. From the whole subunit, you see just the tunnel, and now the whole ribosome is again. And the protein is coming at the end of the tunnel. This is the tunnel, and can start folding correctly. The process many components which you couldn't see in the previous movie, but you can see here. Most of the ribosome is made of RNA. This is the gray here, the small subunit, and the large one. And then there are many proteins. Each protein is shown here in a different color. And just to remind you, the small subunit is doing the decoding. It means it reads the code, and the large subunit makes the peptide bonds. That's all. Very simple when you think about it. So what actually we saw, if we want to see it in a standing picture, small subunit on top in blue, large subunit on the lower part in dark purple. tRNA is connecting between the 2 of them. It reads the code here in the small subunit, produces the protein in the large subunit, And actually the whole story is the coding center here, peptide transferase center, PTC, and I'll talk about it in a minute, and the entrance of the messenger RNA to here. Actually, it's very simple once we know how the structure is. So if we look at it from front, not from the side, small subunit, large subunit, the free tRNA positions A and P are those that are busy in making the peptide bond at the PTC, and the E site is the site of the tRNA going out after it finished its work. So the protein is actually being made here and will come out through a tunnel here. So when we look at the PTC very carefully, we see that it has a fantastic structure, like a crown. And you can see it also here, the position of the peptide bond is here. We looked at the position of the peptide bond very carefully, where peptide bond is being made. And we saw this is sitting here between the A site and the P site tRNAs. The bond will be made here, and the newly born protein will go into the tunnel. And when we look at it carefully, it looks semi-symmetric, almost symmetric. It's not symmetric because there is a hand in all the amino acids and the tRNA, but otherwise it has a symmetrical backbone. And when we look how the A site tRNA is going to the P, all its way is connected by a path that is bound by ribosomal RNA. You can see from blue, which is the A, to green, which is the P site. They go around, and they are ribosomal RNA bases that are made the structure, and two bases that are hooking the whole motion. Why do I talk to you so much about it? Not only because I'm fascinated, but because looking at it, we propose that we see the ribosome before there was a ribosome, the proto-ribosome, the position where amino acids could make bonds when there was not even a ribosome in the pre-life time. And we were very fascinated about it because the piece that we call the proto-ribosome, the A and P places in the ribosome are fully conserved in all ribosomes. So you can see here down a superposition of 7 or 8 ribosomes, one on top of the other. They are the same. So actually the pocket looks like this. It's here in the ribosome. Or from the side it looks like this, and the A to P goes around here. And they are the same in all ribosomes. Now that there are many, many ribosomes, mitochondria and human and so on, and flies and so on, they're all the same. This piece is all the same. And this is a very small piece of the ribosome, not more than 6% of the whole ribosome. So we thought maybe we can make a proto-ribosome in the lab. If we take the piece that builds it, which is actually, I'm not going to talk much about the two-dimensional presentation, but this is here, the piece of where the PTC is. If we take the upper part and the lower part, maybe we can make proto-ribosomes ourselves. This took 10 years, they're making ourselves, but we have them. You can see these are the two parts in here, and I'll try to rotate it. Yeah, it rotates. You can see it from all directions. With the pieces of the P and the A site tRNA in them. So this took 10 years. We got several, not all, pockets that work. And it took another 5 years. And a very, very talented Indian postdoc, Tanaya Bose, who was able to show that she can get a peptide bond even from this little piece. So these are the pieces, this is the reaction, and you can see here, all these made pockets, and all these made the bond. Not all of them, some of them did not, and those that make the bond, most of them were only type P. It means in the beginning there was no distinction between the two sides because there was no directionality. But in this study, we showed that there was no directionality, still peptide bonds could be made in the lab. So it triggered the knowledge or the attention of several journals, not only direct scientists, and we could write how we thought that we can go from the protoribosome to a modern ribosome. Throughout, the sequence of each component of the central region has been genetically optimized for its functional task, and this indicates that the function is superior to sequence preservation and explains the lack of sequence symmetry in the symmetrical region. It means it explains why the A and the P site they are different in already known ribosome, because one is an entrance and the other is an exit, but not in the protoribosome. And in nature, just a few weeks ago, maybe 10 days ago, we got this beautiful report about our work that says, how did life begin? They think that it began with a big soup of RNA, all types of RNA. From this, the A and the P sites were somehow selected by some amino acids that were around and started to create the ribosome. So this was published by Nature, not by us, by Andrea Danz. So we now sort of understand how the ribosome was created and how it works. And we want to talk about other developments. And this is the ribosome as an ultimate target for antibiotics. So because of the fundamental role played by ribosomes, many antibiotics target them. Over 40%, as I said in the beginning, of the known antibiotics target protein biosynthesis, mostly by paralyzing the ribosome. How do the antibiotics so cleverly paralyze the ribosomes? Just before I explain this or I talk about it, pay attention. The bacterial ribosome molecular weight is 2.5 million Daltons. The antibiotics are less than 1,000. How these little things are so effectively stopping life, I'll show you. So first, an example. It's a section through the ribosome, through the large subunit. tRNA is sitting in place. Here, if there is a second tRNA, there will be a bond, and the newly born protein will come out through the tunnel. Erythromycin, which is the first antibiotic that targeted the ribosome, bites here, just at the entrance to the tunnel, and blocks the tunnel. Not fully, but blocks enough so protein cannot go. You can see in a minute, but first you can see the rest of them. So small subunit on the right side and large on the left. And I highlight here the types of antibiotics, those that disturb decoding, those that disturb the hinging, it means the motion from P to A, those that disturb bonding, and those that are sitting in the tunnel. And the names of the antibiotics are written here, and I don't really want to read them. But this is the the clever way that the ribosomes are being stopped by antibiotics. Let's look at it in a little bit more detail. We look into the tunnel. This is erythromycin, the first one. The first antibiotic after penicillin that came into use in hospitals. So it sits in the tunnel and blocks most of it. Not all of it, but enough that protein cannot go. And maybe we can even see a short movie about it. I hope, yeah, we can see. So the first one that you can see here is Edein. This is this yellow one. Very small, extremely clever, not very useful. It was found in Poland, and it's not very useful because it is not distinguishing between pathogens and less pathogens. So, but oops, something happened here. Start again. So the first one that you will see, if it works, yeah, it works. So it's Edein. Have a look. So small, so clever. Here the messenger RNA comes and just blocks it. Messenger cannot bind correctly and cannot progress, so that's it. Finish. Doesn't work. Second that you can see is even smaller. It goes to the A site. It's very useful. Tetracycline, its name is. And it just doesn't let the A site tRNA bind. The third one that you will see, I already mentioned, is erythromycin that sits at the entrance to the tunnel and just blocks the tunnel. So peptide bond can be made, but the protein cannot be progressed out. So that's it. And actually, erythromycin is a father of a big family, macrolides, that we'll talk about, but I want to show you the cleverest one, the cleverest antibiotic, clindamycin. Oops, I'm sorry that clindamycin, it sits exactly at the bond, where the bond should be. So let's have a look at quickly. Here is an Edein that doesn't let messenger progress. And all of this we could see in the lab, in crystallography, in structures. The second that you will see is tetracycline that occupies the position of the A site tRNA. The third one already works on the large subunit. Well, let's wait for it. It's called erythromycin. I must tell you about these movies. They were made by two students from the Art Academy in Jerusalem who became so much in love with biology that one of them left art and is now a PhD at Harvard University. And here is the last, the clever one, clindamycin that sits in the bond. So, oops. As you know, I don't have to tell you, but I will repeat, resistance to antibiotics is one of the most severe problems in modern medicine. And I want to show you how resistance is happening in one case, but you can imagine how others. So if this is the tunnel, the large subunit, this is the tunnel. Along the tunnel here we cut, like here if this is the direction of the tunnel, and we look at this position. So this is the ribosome around, and only this piece, and the amino acids through the macrolide family bind here. So they bind very good, half good, excellent, whatever, but they all block the tunnel. You can see the tunnel is blocked. And they all connected, or blocking, through a connection to a base number 2058. You can see it here. This is the type of contact between erythromycin, for instance, and A2058. Wonderful, everything is fine. That's the way erythromycin blocks the tunnel. But in human, A does not exist. A is G. This is why, like this, this is why erythromycin doesn't bind to human or to higher animals, because this distance is too short. So this is the way the body discriminates the patient against the antibiotic, the bacteria. This is bacteria, and this is higher animals. What happens when the bacteria tries to require a resistance? This is the bacteria, and it just changes itself to G, and there is no binding. Bye-bye. This is a very important, a lot, almost third of the resistance mechanisms are built on A to G, not only to erythromycin, but to all the antibiotics from this family. But that's all. Bacteria, human, or bacteria and resistance. That's it. Can we combat resistance to antibiotics in general? I'm sorry, ladies and gentlemen, we cannot. You heard it already earlier. We can maybe fight against it, but we cannot combat. Because bacteria are very clever, and because bacteria want to live, they will find what resistance mechanisms they can have. So most pharma companies just stopped searching for new antibiotics owing to their expectation for resistance. They don't want even to start. Have a look here. This is the number of 3 types of antibiotics that have resistance that grew in the last 12 years, not even the last, between 1990 to 2002. This is the number of approved new antibiotics in 30 years, between 1984 and 2014. Look at the difference. It's nothing what the companies are doing. And we could not convince them. So if they do, the companies, something, they are changing already known antibiotics. So these are the macrolides, the main structure of macrolides, and here are all types of additions that they added to it in order to make new antibiotics, using the scaffold and connecting the pieces to the side. I don't want to say that they don't work, but they are not sufficient. They are not enough to what the human beings and the animals, and especially in India, it's clear. Animals are also very important customers for antibiotics. So under these conditions, we thought about next generation of antibiotics. And in this thinking, we already added environmental friendly, because the antibiotics that are known today, they are not environmental friendly. They are not fully consumed by the patients, and the pieces that are left are being expelled by the patients and they are so small, they pass most of the irrigation system cleaners, and they go through the pipes and contaminate again. So we thought about new antibiotics, and we thought about they should be environmental friendly. So what are we doing? We have some modest contribution, and I want to show you the ideas that we are using. We still cannot sell anything or produce anything in a big industry, but we have an idea. So if we put one on top of the other, the scaffold of the normal bacteria and the pathogens. So most of the ribosomes are the same. But there are little pieces here and there that are specific. And I show here the little pieces that are specific to the pathogens in blue. You see, not many and very little, but they are only on the pathogen. The pathogen here is Staph aureus. And this is on top of E. coli, normal bacteria. How can we use this new information? So let's focus on one of them. Actually, we focus now on this one, low here, and it looks like this. It's the same almost everywhere, here and here, in the whole structure. But here there is a little addition, a little antibiotic addition of the pathogen. Maybe we can use it. Maybe we can use it as a potential binding site of the new antibiotic. So we looked a little bit more careful, and we found many of them. We call them potential binding sites. These are the potential binding sites. Look how many. We have the same sequence. Only one has this additional piece. This is the Staph aureus, exactly the piece I showed you earlier. So we can look at those pieces and produce to them materials or design for them materials that will bind to them. Here, for instance, there is an additional piece. This one, oops, sorry. This one, we can try to use it as a potential binding site. This one, the red one here, is also an additional one. This one is an additional one. We call them according to the main nucleic acid in the middle. Here there are 2 additional ones and so on. I put them all together. And for Staph aureus, we have those that are the most catching the eye. And we are trying now to stop the life of the bacteria by making double helices to the species. I want to go one by one, but and I have another table that looks at that another side, but it doesn't matter. We could stop the life of bacteria by binding to these positions. So because of these positions are not directly related to the activity of the bacteria, nature did not produce defense against them. They are busy in other more advanced functions of the cell, and I'm sure that within 10 or 20 years there will be resistance to them too. But since we have already 26, among them 12 very strong binding positions, we can think about resistance to each of them. That takes 5 to 10 years, so we are more or less secured for over half a century. In addition, we can look for other problems of cells, not only antibiotics. And these are genetic ribosomal diseases. So there are some genetic ribosomal diseases. Not all of them are understood. Not all of them are known how they start. But there are some that are connected to ribosomes. For instance, here there is a table that shows among cancers those that show modifications in ribosomal proteins according to the type of cancer. That's one type. There are somatic mutations in ribosomal genes that, as I just showed, that identified at least 25% of cancer cells. And the open questions are the mutations expressed in the ribosomes or only in the genes? So this is a question, open question. And what are the reasons for the disease? Are those directly connected to the reason, or the reason is different and they are just there? Same, another example, one of the examples. It's RNA base number 1248 that is shown to be associated with inactivation or disturbance of the P53 control mechanism. How does it do it? Directly or indirectly? And maybe we can have a tool to fight against it. There is even another disease that has many differences, 97 type differences, and they are inherited. And this is DBA, it's an anemia that the changes are in the whole body, not only in the organ that is ill. And the open questions are very similar. Are the mutations expressed in the ribosome or only in the genes? And what are the disease reasons? And we are trying to answer these two questions, and maybe more. Oops, sorry. So here you have a list of mutations, which I'm not sure you want to read now. But you do want to see that all the proteins that have mutations in DBA and also in cancers, or at least the genes have mutations, are located at the surface of the ribosome. You can see it from the two sides, the surface of the human ribosomes. It means if we have a tool to reach them, and maybe the same tool as I explained earlier, we are in good hope. So, in short, we are creating a novel universal chemically controlled platform for identification and targeting mutated ribosomes in diseases of ribosomes. This is my group. Those that have green are still with us. Most of them are left. The person that runs the group is not me, is Anat Bashan, Dr. Anat Bashan. And the person that discovered the protoribosome is, as I said, Tanaya from India, Tanaya Bose. After it was first noticed by Ilana Agmon from the Technion. So this is the group. I really want to show you Tamar, who came 20 years ago for 8 weeks, and she's still around. She had birthday the day that I took the picture. You can see the cake. Maybe you don't see the cake well enough. Oops, the cake left. And she has a cake like a ribosome, if you can see. And then you can also see me with hair full of ribosomes. So thank you.
Maybe some questions?
Of course, many.
If there are some questions and comments, I have one.
I will let you ask.
You showed a big binding site of ribosome. You can optimize the design of antibiotics to take care of those extensions and bases.
We can, but then it will go to all ribosomes, also to the good ones. If these sites are expressed in all ribosomes, we don't want, because then there will not be differences between them.
So slightly lower affinity, some other bad effects.
Yeah,
but
if we can play with the affinity, of course, that's a good idea.
Okay, so any further question? Yeah, Samuel.
Yes, Professor Anna, you have identified many potential targets on the binding sites. Why don't we use the fragment-based drug discovery? Fragments are very small, like 100 Daltons. Instead of using the 500 to 1,000 one, then we can go on building one on another. So, what is your opinion on it?
To look at the ribosome at many pieces?
Many sites.
Many sites is okay. If the sites are different between the bacteria, the disease-causing bacteria and the healthy ones. If there are changes, yes. If you show me them, I'll be very happy to take them. So I showed some of them on the surface, which we can target from the outside. Maybe we can also target inside, but I want you to show me which ones.
No, instead of, we'll start with one fragment and we can just, go on building up.
Yeah, but you want a fragment that does not exist in the human.
Yes.
You want only on the bacteria, the bad bacteria. You don't want to kill all the good bacteria. So I think that the companies were mainly interested in them, and they didn't find some. They found very few, and they found problems in targeting them. I don't know all the details, but I know that, as far as I know, they stopped this direction of research because they found that they will always kill also a good one, a good bacteria or the good person or animal. So we looked for the surface, not because we thought the surface is better than the inside, but because the chemistry is more in our hands. I would like much more to kill the ribosome from its interior.
There is one more way. Can you not think about bacterial proteins as a better targets eventually?
Bacterial proteins?
Yeah.
Yeah, sure. But that's not me.
That's not you, but that's one option where you can play with
That's an option that all of you can take, but not me because I don't know enough about these proteins. But you're right.
Yeah.
Yeah, Professor, I have one dream actually. I just want to tell that you have given a wonderful lecture. In this lecture, you have given us the idea that even we are going to create a best drug. What will happen? These microbes, they will learn the trick and they will learn the trick and now they will become antimicrobial resistance. My question is, can we create a world which is free of germs?
No.
Completely free.
Don't do it.
This is my dream.
No, don't do it.
You don't do it because he thinks that these bacteria are important.
Because
you see,
we have seen the situation in the COVID-19 time. Many individuals, they have suffered. And most of the germs, they are being passed through air. We now have clean the water, okay? But now it is the need that future generation, they must have the strategy that there is no need of any drug. If we are going to have an environment which is not going to have microbes, what is the harm?
How do you know?
Yes, we can.
I think that microbes will always show up somehow.
We are now able to create germ-free labs. If
We are? Are we?
Yes. In the world there are germ-free labs.
In the lab?
Yes, you can.
And you want all the people to live in a lab?
No, I want to have. Maybe you can say I am foolish, but what will happen if you are going to create a drug? Some companies, they will make profit. Okay. Next we are going to create another drug. How long this battle will keep going on? I just want to tell you. If you see the Hindu mythology, our Lord Shiva, okay, he always put some bhasam, okay, so that he is going to remain.
Yeah, we can take it during the lunch.
Lunch, yeah.
No, this is the only interesting piece.
Okay, any other? Okay, Ada.
But in lunch, you may find the bacteria.
Yeah, thank you very much.
That's okay. What I'm mostly proud is the origin of life, much more.
Yonath, please.